In this video, we'll be discussing common aging changes that occur in our organs of sensation, our endocrine system, the immune system, and in mentation. Let's begin by talking about our five senses. Overall, as we age, our senses will become less efficient. As we age, we will develop what is called presbyopia. This is simply the inability to focus or accommodate appropriately. This is usually due to a decrease in elasticity of the lens of the eye and will lead to the need for corrective lenses. We also experience narrowing of our visual fields, which also means a decrease in our peripheral vision. Our night vision also decreases. This makes it especially difficult to drive at night, as well as we will require more light to see properly. For example, when reading at night, an older person will need more light in order to adequately see the words they are reading. This may also become an issue when an older person is trying to move around at night. For this reason, it's always a good idea to make sure night lights are on in order to prevent falls or other injuries in the dark. As we age, we also begin to lose our depth perception. This makes it difficult to navigate steps and curbs or other uneven surfaces. This places them at a higher risk for tripping and falling. Older adults also lose some of their ability to differentiate between blue, green, and violet. This is due to a yellowing of the lens. Dry eyes may also become an issue for the older adult. Macular degeneration and cataracts are something we will discuss further throughout this semester. At this point in time, I'd like you to understand that as we age, the blood supply to the retina may be decreased. This may lead to a problem called macular degeneration, in which there is a loss of central vision. Many older adults also develop cataracts, which is where the lens becomes more stiff and opaque. This can lead to increased sensitivity to glare, blurry vision, as well as poor night vision. Let's talk now about the ears in the sense of hearing as well as equilibrium. As we age, we may develop a problem termed presbycusis. This is simply termed progressive hearing loss. High-frequency sounds are lost first, which may make speech sound distorted, making it difficult to understand. Exposure to loud noises makes this worse, as well as the buildup of cerumen, or what is known as earwax. Some older adults may also experience a degeneration in the vestibular system, which may lead to a loss of equilibrium, once again placing them at a higher risk for falls. Older adults may also experience a decreased sense of taste and smell. As we discussed in an earlier video, this may make eating much less enjoyable. They may also experience a decrease in tactile and temperature sensation. This places them at risk for the development of pressure-related skin breakdown as well as burns. As we know, the endocrine system plays a large role in the health of the individual. We'll not go into great detail here, but I do want to point out several aging changes that affect the endocrine system. Let's first discuss the thyroid gland. The thyroid gland is responsible for maintaining our metabolism. In general, as we age, we have a decrease in thyroid activity, leading to a decrease in our basal metabolic rate. This being said, we don't see any changes in the secretion of thyroid stimulating hormone, otherwise known as TH or TSH, or the formation of T4. We do, however, see a decrease in formation of T3. Although the T3 is lower, thyroid function usually remains adequate. From our adrenal gland, we see a decrease in the secretion of aldosterone, androgens, glucocorticoids, estrogen, and progesterone. Aging changes in the pancreas lead to a delayed and decreased release of insulin. This in turn leads to a decrease in insulin sensitivity as well as decreased glucose metabolism. All of these actions together place the older adult at a higher risk for the development of hyperglycemia. Many older adults develop type 2 diabetes mellitus. Aging also takes a toll on our immune system. Older adults may develop what is called immunosenescence. This is simply a decreased ability to form an immune response to infection. This places older adults at a higher risk for the development of an infection. They are especially sensitive to pulmonary and urinary tract infections. One interesting note is that due to the decreased ability to mount an immune response, vaccines may not be as effective in the older adult. For this reason, their vaccines may need to be given at a higher dose. As we age, our body's inflammatory defense mechanisms also become less effective. This may lead to a decrease in pain with injury, as well as a decreased likelihood to develop a fever when they are sick. Unfortunately, older adults are more likely to develop an increase in pro-inflammatory cytokines. This places them at risk for the development of atherosclerosis, diabetes, and osteoporosis. In terms of body temperature, the older body has more difficulty regulating body temperature. Older adults usually have a lower body temperature and are susceptible to both hypo and hyperthermia. They are more susceptible to hyperthermia due to an impaired sweating mechanism. Let's take a few minutes and discuss the changes that may occur to the mind of an older adult. We know that our ability to think and remember is influenced by our general health and our senses. It may also be affected by depression and social isolation. Older adults do not normally experience a change in personality. Some personality may change with big life events such as retirement or the loss of spouse. Older adults do tend to be more open and honest in their communication. They may also experience some memory loss. This may occur in terms of short-term memory, or remembering something for 30 seconds to 30 minutes. Long-term memory may slow if not used. There may also be a decrease in working memory or the ability to retain information while manipulating other information. With normal aging, these changes should not be drastic. Older adults do tend to be more easily distracted with information, which may lead to a decrease in their attention span. It's difficult to determine if an older adult becomes less intelligent because it is hard to compare those of different health, education, and social status. Overall, we believe that our basic intelligence is maintained. Let's talk about two different types of intelligence, crystallized and fluid. Crystallized intelligence deals with verbal comprehension and arithmetic operations. The centers for this are located in our dominant hemisphere, and this type of intelligence is usually maintained with age. Fluid intelligence, on the other hand, does tend to decrease with age. The centers for this are in our non-dominant hemisphere, and this deals with emotions, non-intellectual information, creativity, spatial perceptions, and aesthetic appreciation. Older adults may show a decreased readiness to learn and may rely a great deal on previous experiences. They learn new material best when it can be related to previously learned information. They also tend towards simple associations rather than being able to deeply analyze a situation or problem. We've all heard the term that it's hard to teach old dogs new tricks. This may actually be true in some cases, as older adults tend to have more difficulty in learning new habits. Well, this concludes our discussion on aging changes for this session. Please don't hesitate to contact me if I can help clarify any of this information.